No, I like use the like. I always get shocked things like I watch like the treatment. So then I'm like get into it and like failure.
So, if you guys want to go ahead and put your name in the chat and what district or organization you represent, so we know who's in the room, and then we'll go ahead and get started. So, welcome to today's webinar. Our focus is on family engagement in school-based healthcare. My name is Marwa, and I work with San Bernardino County Superintendent of Schools. And today we actually have Sang from California School-Based Health Alliance. Many of you guys know her, you've worked with her, you've attended her coalition. And we also have Ileana from Val Verde Unified School District from Riverside County, actually, with us today. So today she's going to focus on discussing how families can access their school-based health centers and essential resources that are available for them. So with that being said, please join me in welcoming Singh and Ileana. Thank you.
Yeah, thanks, Mara and the SBCSS team. Ileana, go ahead and do screen share. And I'm pleased that many of you have taken time out of today to join us today. And I see a couple of, or actually a number of familiar names, and I want to welcome Jose to this space, um, which is really nice to see in this space. Okay, so the California School-Based Health Alliance, we've been partnering with SBCSS on a number of things, including this, I think now 4 years into this, a webinar series, really discussing a wide range of topics on school-based healthcare, school-based health programs, and really wanting to build capacity, and to help all of you think about how to do this in your own campuses and your districts. Because we all know just the power of meeting students where they are, providing the services that they need. And for this year, we're doing 3 webinars, and it's interesting. Mara and her team, they do a good job of assessing the interests of all of you. And this topic came up, this family engagement in school-based healthcare, came up as one of the topics that you're all interested in. In wanting to learn more about. And it's just fantastic because it so fits in, a lot of the work that many of you are also involved with, community schools, and also in thinking about schools being the anchor of our communities. It's really families, right, who are, really, needing to be part of the school community and needing to be engaged in this. But today we're going to really zoom in and actually look at um, how we engage with our families in terms of the school health programs and the school community when we think about school health and wellness. And so again, thank you for being here today. Next slide. Many of you know me. I'm Sang. I'm with the California School-Based Health Alliance, and I've been working in school-based healthcare for almost 20 years. It'll be 20 years, I think, this fall. And so I'm really pleased that having worked largely in Los Angeles, I've been able to shift over about 4 years ago to work in the Inland Empire. And, most of my experiences and time in this field has been supporting LAUSD. And I always say, if we could do things in LAUSD, you could do things almost anywhere. And my background is in public health. And I'll go ahead and have Ileana introduce herself.
Hi, yes, good afternoon. My name's Ileana Dodge, and I work here with family engagement. I'm the manager at Val Verde Unified School District, and it's an honor and a pleasure to be here this afternoon.
Yeah, thanks, Ileana. Next. In case you don't know who we are, California School-Based Health Alliance, we are a nonprofit organization working very closely with California Department of Education, California Department of Public Health to really advance school health services, in schools, or health services in schools. And we work statewide, but really are invested these days largely in the Central Valley, in the northern part of California, and then here in the Inland Empire, where we've been for almost 4 years now, supporting the work being done in San Bernardino County as well as Riverside County. And so it's really, when we think about that, that's 800,000 students across 59 school districts, in our 2 counties. And so It's a large student population, large geographic area, and there's so much need out here that we are so pleased that Kaiser has really invested in this region, and that we are here with all of you, to help really advance this work. And so that's who we are. And then next slide. I always have to make a pitch for membership. We are a nonprofit organization, and just encourage those who are interested in supporting this work to be, organizational members. And we are hosting a conference that I'll talk a little bit about later, but being a member also gives you some very discounted registration packages. Next. So we're gonna just really set the stage here and just do two really brief polling questions. I'll go ahead and have Mar pull that up, and then we want to engage all of you a little bit in this.
Yeah, I didn't used to suck, but now I have no idea of what I.
We've got 19 responses so far. I think we'll wait a few more seconds, Mara, to have others respond. Okay, should we go ahead and close it, Mara? Okay, are we looking at results now? I guess we are, huh? Okay,
Yeah,
good.
yeah.
Okay, perfect. Yeah, so I see a range of involvement here, but it's nice to see that more than half of us are actually somewhat involved or very involved. For the 7 people who responded very involved, if you don't mind just getting off mute and just sharing with us, what that looks like. We asked you to what extent, but we actually want to hear, what does that look like? Hopefully someone will be able to just share, because we'd love to just hear about it and applaud you for being so involved. Anyone? No? Okay. Okay. All right. Ileana, do you want to do the next one?
It looks like some already answered. So what level of interactions do you have with parents in your professional role? And so just for the first question, many of us who actually speak, who work in this environment, sometimes we are unable because we're dedicated to education within our roles during the day for our job. Sometimes it's really hard to actually be in the classroom and volunteer. But just know that we are engaged and we are involved in other ways. So just wanted to put that out there. But yeah, I think it would be very interesting to see from the people who are joining us today, how much do you interact with your families, with your parents in your professional role? So I see that some people have answered. Anybody else? Or I think the poll has already closed, right? Because it was included, both questions were included. So interestingly enough, 9 out of the 24 people, 38% said some, and 8 out of the 24, 33% said a lot. So it seems like many of us do interact with our families, and that's a good thing. So I'm very happy that you're here today. Hopefully, we're going to be able to connect a little bit more about that.
I want to have the background that has a logo on it. See how they got that look.
Okay. Okay. Sorry. If you all can mute yourself, I think that would be really helpful. Thank you, Mar. We'll go ahead and take down the poll and we'll continue on. See. Okay. Thanks, Eliana, for advancing the slide. So a few things before we really hear from Valverde. I wanted to mention many of you are very familiar with the CDC framework for school health, and thinking about how the community, really is a wraparound around everything that we do in school health. And of course, family engagement is one of those pillars, in the framework. And I love that because again, our students only, are really embedded in the family structure. And so I think this is really a beautiful way to think about when we say, healthy students, healthy schools, really healthy families, healthy communities, right? It's really that tiered system. And I want to just go over really quick the definition of what how CDC frames the family engagement piece, and that is active engagement of parents, community resources, and services to provide an integrated school, parent, and community approach for enhancing the health and well-being of students. Again, thinking about how we engage parents, but really how do we integrate parents, within the school community as well as the school culture and the school operations. And I know that we're going to really hear some beautiful examples from Ileana later about how she's able to really create spaces for that to happen at Valverde Unified. Next slide, please. I mentioned community schools earlier. A number of you are in the space who are also doing community schools. And again, if you're familiar with this model, it's one of the four pillars of community school.
Yes.
For everyone, I'm going to try to mute people as I'm talking as well. But again, looking at family and community engagement is really a strong pillar of that. And I know, this morning, even in our community school space for the region, the focus was actually on family engagement. And so it's funny how to see that, those two align just for today. Next slide, please. One of the tools that we use in school-based healthcare is this, and you'll have access to this with a QR code later. So, I apologize how small it is, but it's just more of a reference like image. But we have a beautiful tool that has been around for almost 10 years now, and it's called the School-Based Health Center Best Practices Checklist. It's got 20 different elements of what it really means to have high functioning school-based healthcare programs, school-based health centers, wellness centers, and one of the highlights of this best practice checklist is, if you can go to the next slide, is under this, strengthening prevention and population health by really looking at public health approaches. And so one of those things that outline in that checklist is really that the school-based health center regularly delivers health education in the classroom, conducts school-wide health campaigns or events, and has presentations or events to educate parents and family members. Again, just want to mention that it's really actually called out in our, guidelines around best practices for healthcare, for school-based healthcare. Next slide, please. I just want to share a couple of examples. Again, I spent, 10 years in Los Angeles, working there to support their school-based health centers and wellness centers. And I went through my old files and found a couple of photos of our of the wellness network within LA Unified, and just want to quickly share, some of the things that I saw there around really family engagement and how to integrate those practices. The top photo there is actually Locke Early Education Center. It's actually located in South LA, and it's right next to Locke High School, which is a fairly large campus. And when they were actually building out their wellness center, which they decided to put at the Early Ed Center right next door to the high school and really have that pathway, for the high school students, one of the things they decided to do with their space was to actually build an exercise room right next to the school-based health center. And that was a way for parents to come and, have Zumba classes and yoga classes, and really a space, for parents to convene, while their little ones are, in school. And I just thought that was such a beautiful, I think, way of thinking about movement, thinking about how do we incorporate, physical activity, and that it's a welcoming space for parents. We think of schools as the safest, most trusted place in our communities, and and for schools to be able to think about how to create spaces, for parents to be able to participate in that, I think was really such a beautiful model. And I remember visiting the space there, and it was such a beautiful room, and they use that room for a wide range of other things. But again, really being intentional about how we support our families and our parents, in the area. And the bottom photo there is Fremont High School, which is also in South LA, and their wellness center, beautiful place. When they back in the days when we had FitnessGram, as you may all remember, when FitnessGram data when fitnessgram testing was around and schools would get their data, oftentimes, if schools are lucky to have full-time school nurses or even, other health technicians, the idea was, just sending out the fitnessgram data to students and not really do anything with it. But what Fremont High School decided to do was actually include um, school nurses as well as school-based health center and parents into looking at fitnessgram data. And for students who failed the fitnessgram test, they were able to actually get called in, not get called in, excuse me, be invited to the school-based health center to really talk about, their results and also to think about ways in which they can actually address, some of the things that could improve their health. And parents would be invited in there. But again, that was an example of something that was universal, something that, schools are responsible for, school nurses are responsible for, but how do we do this, in conjunction with parents and the students themselves? And so just wanted to mention those two examples from LA. Next slide, please. Okay, so I'm going to turn over to Ileana, but I wanted to just kind of share the context behind this. When we were putting together this webinar, we thought, parent engagement is such a great topic, but it's also something that, I think people are doing, but then how do we really understand sort of the nuts and bolts of someone or a location that's doing it really well, like super well, that we've been really impressed with their work. And so Valverde came to mind, and we said, let's reach out to Ileana to see if she would be willing to present her information in her program. And one of the reasons why is because I was actually taken back when they shared their mission statement and their vision statement. And you can see here, a big, the start of their vision is to love our families. And I thought to myself, wow, like that is such a bold statement, right? Like to actually come out and say, not only do we, want to do this work and support our students and our families, but to love our families, our community, here's what we need to do. And so I just thought they, it's like that, just go big, right? And they are bold and not afraid and really have built a program completely around how they love their families and want to support them so much. And so with that said, I want to turn it over to you, Ileana, to just really showcase your work.
Thank you, Sang. So, yeah, we're super excited about the work that we do, and again, it's an honor to be in this space with you all. Very happy. I do want to share a little bit about how we got here because you're going to see a series of slides, but more than that, I want to share with you our journey and some strategies and the challenges that we faced along the way, and how very fortunate and blessed we are because we have been able to surround ourselves by amazing people within the district. It's not just a one-person show here. Even though you see me today, there's many people behind this effort. So how did we get here? Someone has to have a vision, and you saw the vision statement and the mission statement, and I wish I could take credit for that, but that's actually our director who came up with that many years ago, in around 2014 or so. We wanted to put that up front and center on our website. And so she has her doctorate in family engagement. And so she had this idea. And yes, it is something that is different. You don't see the word love in mission and vision statements. So yes, super happy about that because that guides the work that we do. It reminds us about our why. Also, we wanted to make sure that we looked at the needs. It wasn't just something that we thought our families needed. It's constantly, it's not just how we got here, but how we continually move forward. So what is it that our families need? And perhaps pre-pandemic, it was something. During the pandemic, it was something else. And then afterwards, okay, it's adjusting everything and making the necessary changes to make sure that we continue to assess what the needs are of our community. And stakeholder engagement. Are we including the community in what we do and the decisions that we make? That is crucial because when we include our stakeholders, there's ownership for the work. And it's not just the family engagement team that is passionate about the work that we do. More people engaged, more people involved. That means that they're also going to be passionate and they're going to work hard for successful outcomes for families. And of course, strategic planning. We feel that we've come a long way, but there's always more to be done. And so keeping that in mind, the model, making sure that everything that we do is revolves around our positive student outcomes for our students that are enrolled in our district. Something crucial that we have been looking forward to was to actually have the health services available within our district at a site-based clinic. This happened we went to visit a neighboring school district in Harupa way back when. That was before community schools. And again, we need to give credit where credit is due. Jose Campos. He graciously accepted us there, and we were able to see his site-based clinic. I went over there with the risk management director. I went, okay, we started to work on it. And then eventually the organization that we were working with went under, so they went bankrupt. We had to find a new partner. But we need to continue with be strategic and continue to be passionate about getting things done. So yes, family engagement is crucial, making sure that our community resources are on board, that we're always looking for community resources to support the work that we do, and always looking into ways in which we can make sure that this translates into academic outcomes for our students and general well-being for our students. So again, the anchor is student education and achievement, and of course, well-being. So the comprehensive range of services, we have health services, family support, and educational connection. With our on-site health clinic, we offer preventative care and screenings, mental health support, medication management, and all of this is free. So if our families are eligible for Medi-Cal, they will be covered by Medi-Cal, and if not, it is my understanding that they will find a way to cover the services. So that is huge. And just to give you a quick example, if that were not to be the case, I hear about it. So somebody reaches out, maybe one of our site liaisons reaches out to me or to their principal, and they reach out to me and they ask, hey, a family mistakenly got a bill. And so I contact our partners with the site-based health clinic. I ask them, and it's fixed like that. So that connection with our community resources is crucial. And so insofar as family support, we have a community laundromat with 10 washers and dryers that are completely free. We provide the laundry detergent and the dryer sheets. And we also recently purchased 2 sets, washer and dryer of extra large capacity. So about 60 pounds, super excited about that. We have a free community store. We have classes for our families. And of course, we're always sharing resources with our families as well. The educational connection, well, of course, when you offer the basic needs for families, you're going to see improvement insofar as attendance, because if our children feel comfortable wearing nice, clean clothes, then that's not going to be a barrier for them to go to class. It's going to reduce barriers insofar as learning. And when you have their vaccines taken care of right next door to where their middle school is, for example, and our families can just walk over there, so I'm talking about the site-based clinic, then that's also something that's going to be helpful to them. And not only do we have the site-based clinic, but we also offer vaccine clinics throughout here at the district. So yeah, and never forget about always strengthening the family school partnerships. That's super important as well. And what is the connection? Well, healthcare access, of course, improved attendance. When our families' needs are met, reduce stress, better focus. And I have to say that our families are going through a lot. The community is going through a lot. And so just to be able to offer basic services like the laundromat or the free produce once a week, that is a little bright spot in people's days. The mental health support, and I'll provide more information on that. To proudly be able to say that our site-based clinic has a behavioral health component. We're super proud about that. But that's not the only thing that our district offers. We have many educationally related, no, educational mental health. I forget about their acronym, but we have therapists that support our students. And that was a direct and conscious and purposeful investment on behalf of our district to support our students. We also partner with Care Solace, and so that's another good thing that we have. And by showing the support for our families and our students, our students are more apt to be emotionally ready to learn. And finally, the parent-family engagement option, that's also helpful. And I'm going to go into a little bit more detail on these things. I just wanted to give you the big picture. It's important that we note that, again, I'm here in front of you, but the story goes, it's much, much deeper. I could sit here all day and talk about the wonderful things that we do, but if you're in this field and you don't have the support from your leadership, if your leadership is not on board with what you want to do, nothing is going to move forward. So, like I said, when the mission and vision statement is coming from your director, then you know that you have somebody that's going to have your back for the work that you're doing. And you need to have somebody that is fully on board and loves the community. So yes, it starts from the top. Having our Deputy Superintendent, Mr. Lenore, go to our meetings and support us. It was his idea to have the laundromat, so that says a lot. That speaks volumes. It was his idea. In the beginning, when you think about the logistics for making this happen, there are just so many layers of complexity to fulfill that dream. But here we are. I'm able to be here and say, yes, we do have a laundromat. And yes, everything is free. The detergent is free. And the dryer sheets are free. Would I have thought this possible 10 years ago when we were barely starting? Or no, but here we are. So yes, making sure that we have strong leaders behind us is going to be able to help us with the funding. It shows the district's commitment, and think about sustainability as well. When you have people who are behind you that support you, then that means that you're not just offering something for the time being, but hopefully you're implementing systems that are going to stay for a long time, even if you're not here, even if the team is not here, or the original people that are doing the work are not here. But once you implement a system, that makes a huge difference. That means that families or future generations are going to be able to continue to have, because they're going to be used to this level of support and they're going to be counting on that. So making sure that we create partnerships when the leadership is on board and they're doing presentations on family engagement, they're also creating partnerships, and they're also being accountable for the work that's being done. So yes, leadership support turns vision into action and action into impact. Again, strong outcomes begin at the top. Just say, okay. I want to be very clear here. Nothing that we nothing that we have that I'm going to be showing you is able to happen without a great team. It's not just a good team, it's an amazing team. Because when we combine our strengths, obviously we're going to have better outcomes. We collaborate, we're going to have new ideas. We have each other's back, we support one another. And of course, with time, you build that trust and the loyalty. So yes, we're able to achieve more. I want to introduce you to our team. This is our team. So it's a small team, but a very mighty team. We have a field supervisor. We have our bilingual parent engagement specialist. We have 3 community liaisons, and we have 2 bilingual clerks. So an amazing team that does so much work behind the scenes and in front of our families and our community. This is the full team for Dr. De La Torre. She's our director. We have our amazing secretary, Miss Jennifer Hamley, and also our African American parent engagement specialist. He is a teacher on special assignment, Quantrell Willis. So we're part of a bigger team, but the family engagement portion is right here on the left. In addition to that, because we don't work in silos, the district has many site liaisons. So that is also a huge help. And we work with them specifically to support us when we have mobile dental services go out to sites to support us. They invite us to their site events as well. So it's a huge team. It's an effort on behalf of the whole district. I want to talk to you a little bit about the challenges that we've navigated along the way. We talked about a vision. We talked about our mission statement. But what about bringing all of this together? And how are we going to coordinate? And you saw the team. You saw the image of our amazing people. But we didn't always have that. Before, it was just Dr. De La Torre and myself, and then eventually we started to grow. But you have to be able to be accountable, and you have to justify and ensure when you're asking for additional support that you're accountable, and you say, yes, this is justifiable. This is what we want to do. So very strategic, but it doesn't happen overnight. You need to persist. You need to be dedicated and very passionate. So building trust, how are you going to build trust? Well, your work should be able to speak for itself. Be very transparent. Keep your data. And if you don't have the data, develop systems so that you track what you're doing, so that at a moment notice, if your deputy superintendent is going to be doing a presentation and they ask you for the number of loads that the laundromat has serviced, you're able to provide that immediately. Because if our leadership feels proud of the work that we're doing, they're going to be able to show it off. But if you don't have the systems in place, and this didn't happen just like that. You just no, you have to work towards that. You have to have a work with your team and look for ways in which you're able to all be accountable. But again, it's developing strong relationships. Insofar as communication, yes, we have had that, but my role was in the beginning, I used to be a translator, interpreter, and then I've moved more towards family engagement. But once upon a time, we didn't have the devices needed for interpretation. All of that, we had to buy that many, many years ago. And then eventually you realize our families are different. And so maybe it's not just Spanish and English. So you look for other ways. You contract out with an organization that might be able to serve families that speak Canjobal. So it's always about being open-minded and finding ways to work around the challenges that appear. And of course, funding and resources. With the data, that's how you're going to be able to prove or showcase that the work that you're doing is valuable and you are deserving of the funding that you're requesting. So again, one of the biggest challenges has been, but also exciting challenge is to be able to design something from scratch and start from the bottom. So very exciting, but yes, these things don't happen overnight. We have to be persistent. We have to be dedicated. And I think most importantly, we need to love what we do and be passionate about it. How we navigated the challenges, people, they're going to be your best allies. So make sure that you develop relationships, not just with your community partners, but also within your district, because there are so many people that we need to make the work that we do happen. It could be from the people in the warehouse that deliver the items that we need for an event, the people that deliver the chairs and the tables for our huge district events, or maybe it could be just the art supplies for our creative arts session. You always need people. It could be maintenance and operations, making sure that the fobs are working for the health clinic. It's every day, all the time, and there's a huge team. It's not just the family engagement team that I just showed you. It's everyone here at the district that supports us. It's the nutrition services team that makes sure that we have food for some of our events and it's delivered and it's warm, and they had to push the food warmers to our conference room, which is super, super heavy, or having food servers at our African American Parent Advisory Council meetings, making sure that they're there. So it's the people. Perseverance, because you're not going to get a yes all the time. And what are you going to do about it? You're going to have to be that person that is on it and on it and on it. And when the stuff that we have today, or the services that we have today, when they didn't exist before, and you're barely trying to push your way into this world, you're not always the person that everybody likes because they don't know you and they don't know what it is that you're trying to do. Now family engagement is a big deal and everybody wants to do family engagement, but if you're barely starting off, you have to want to do this. You have to persevere, and knowing that you might not always get a yes, but what are you going to do so that you do get that yes, so that you are able to expand the services because you know that your community needs these services. If you want a laundromat and somebody says, "What? A laundromat? What? Provide free soap? You crazy? What are you going to do to make that happen? Are you just going to accept the no?" So it's just something to think about. Plan, because what you have today, maybe it's not going to be available. So what are you going to do? What other services do you think you could uh, offer? Or if you have something right now that's not working out, then what can that morph into? Again, I said it before, love for the work. So yeah, do want to share something really quickly. Let's see. I want to share this dashboard. So give me 1 second, please. And hopefully you can see a dashboard right now. Thing?
No, we're still seeing your slides. I
Okay,
think you have to stop screen share and then switch.
that's right. That's right. Stop share. And I'm going to share again. Okay, can you see a dashboard now?
Yep.
Okay. I don't want to go into the numbers. Most importantly, we had a soft launch for our health clinic in May 2023, and up until today, yesterday, we've seen a total of 7,256 completed visits, and we're always working on this dashboard. But look at the immunizations. That's 812 people that got their shots. And look at the behavioral health. It's 1,916. So what I really want everyone to focus on is not necessarily the dashboard, because we're still working on it. And, sometimes the numbers are off, or sometimes I don't really think that our dental services are truly reflected in this dashboard. But there's something else that I wanted to share with you. Let me see. The purpose of me providing this dashboard with you is hold on. Is going back to the people. What kind of relationships we have with the people we work with? Because that dashboard is through Power BI, and that is created by the site-based health clinic that we work with, and that's Neighborhood Healthcare. And this is not an advertisement in any way for them. It just so happens to be the team that we work with. So having these joint operation meetings with them on a regular basis, that is so crucial. Making sure that I found a picture today, just to give you an example of when we were first envisioning this site-based clinic. We took a picture. It was their facilities person with our team, the people who were going to build the site-based clinic. I found it and I was able to text it over to the chief operations officer at Neighborhood Healthcare. And that was it. He responded with a little heart, and that was it. But what I'm trying to say is for their team to put up this dashboard and to create it and to bring their IT people to create this dashboard for us, that's huge. It's good for them because they have the results that they are looking into, but it's also huge for the district because again, we go back to that part that says, okay, are we really making a difference? Is all of this worth it? Are having Val Verde allocate these resources, is it really going to be beneficial for our students and for our community? And so on the surface, of course, we might be able to say yes, but where's the proof? So just something to keep in mind. What do? We have so many things that we offer. I asked the team to put together this flyer because we call it La Presumida slide because it just kind of showcases everything that we have. It's our shock and awe, just a little bit of something, and one visual. And how do we get the word out? Well, we have our weekly bulletin. We use Peach Jar. We use Parent Square. We have our advisory councils or committees. We have Asian American, Native Hawaiian, and Pacific Islander. DLAC, of course, PAC. We go to school events. We set up tables at, for example, this picture is from the mall. There was a back to school backpack giveaway event that we were invited to. And so we say yes. We also have our list of course and service offerings. We have our website. So it's super important to get the word out. Do we come across challenges? Absolutely. But that's why we always continue to try and we don't give up. So we have a program called Plaza Comunitaria. And all of a sudden we had all these graduates in the fall, which is wonderful. That's what we strive for. But now in the spring, we're having low attendance. So we're having our liaisons go out to sites and try to recruit because the registration period is going to close soon. I encourage you, when you feel like your glass is half empty, somebody needs to stay with the feeling that no, it's half full. Somebody needs to be that driving force that is going to say, no, we're going to find people. And yes, we're going to continue. So don't lose hope. Sometimes we're going through difficult times and you might notice that our families have other things on their mind and that's justifiable, of course, but what can we do to support them? Let's try to meet them where they're at. What is it that they need? So this is our weekly bulletin for this week, and you'll see that we have an upcoming session called Know Your Rights. So maybe that's what they need. Maybe normally we did this in the fall in person, but we're going to do this through Zoom this time. So look at what works for you and try to meet the community's needs, and always try to have a pulse of what your families are needing it during any specific time. Don't forget the importance of strong partnerships. We're always so very, very thankful for all of the many people and organizations that support the work that we do. Again, we're not doing this alone. And I believe Sing is going to be sharing this PDF because there's these two columns here. We say thank you to our agencies, but sometimes we don't know what exactly it is that they offer. So in case this is helpful to you, you can take a look at this and maybe you can get some ideas for your agencies or your districts or wherever you might be. Okay, so think about creating safe spaces. When we were talking about planning, when we were first thinking about having a family engagement community resource and learning center, this was a part of our slide, the part on the left. We wanted a place to make sure that our families could say, I belong here, I am respected, I am valued, I am safe. And this was before, so even more so today, right? And also, this is an environment conducive to learning with my family. So not just for the adults to come in, but if we offer workshops on Saturdays or robotics, or if we offer workshops on Saturdays with the Home Depot to offer um, a toolkit of some sort, they're able to come and they're going to feel okay to be there with us. So we bring out the consulate so that families don't need to drive all the way to San Bernardino, for example. So we try to provide services that our families are really going to be able to benefit from. It's not just what we would like to offer, it's what do you think is they can use. So yes, hundreds of people came in the fall. I think over 500 people came. Were they all from Val Verde? No. But that's why it's not just Val Verde family engagement or community engagement. It's community engagement in general. Some services we do need to limit to just our families, but the health clinic, it's open to the community. And our classes, they're open to the community. The laundromat, it's just for families that are enrolled, that have children enrolled in our district. Same thing for the store. So we do have to set certain boundaries, and that's just because of the funding, but it's not because of lack of love or anything like that. So yes. I wanted
Eliana, can I
yes.
just mention real quick? I love that you have these values here. You know, I belong, I'm respected. We see that we see these set of values at schools, right, for our students, right? And it's so great that, you know, you are all extending the same set of values to the families, you know, that they also want to belong there and feel respected and valued and safe. I just want to chime in about that. I love it.
Yeah, yeah. And I just remember one day when our families were celebrating Mother's Day. I think this was a year or two ago, maybe last year. But yeah, they made it a whole party. So they went to the laundromat, they were doing their laundry, but they also did a little potluck for tortas. And um, it was just amazing. And then having another parent just go, they found a sale for children's shoes and they just came out and they brought it and donated it for us. And or our ESL class, they get so happy every day. We have morning and evening classes. So yes, just wanted to share that with you. So this is what we've got going. This is the Family Engagement Community Resource and Learning Center. But like I said, this is not just the only thing that we do. That's why I showed that the slide with so many other things that we do. This is just one portion of it. We have our health clinic, we have mobile dental services, we have vaccines, the laundromat. These are the two big washers right here. We have a safe space where our children can perhaps catch up on their homework while their parents are there. We have yoga. We had our yoga class today. We have food distribution. We have our community store. We have ESL. And recently in the fall, we offered for the first time our Nurturing Fathers program, which super happy to have that as well. So, and that's pretty much it for me. Just again, very thankful for the opportunity to be here today and honored to be with this group.
I think we'll do, yeah. So we'll pause for a second and just take questions or comments about just what you've been hearing. Or just even your thoughts about, you know, the scalability. Yes, Jose Montez.
Yeah, thank you. Thank you for sharing all that great information. It's really impactful in terms of what you've been able to do there. And I know you talked a little bit about funding and all of that. So I'm interested to hear a little bit. Interestingly enough, there was a situation today where a family. So I'm new to the district. So I was with LAP previously, and I'm now here at Rialto Unified. So I've been here about a month, but we're well underway of kind of gathering what we need and so forth. And one of the things that came up was laundry services, which is an interesting thing, right? So I'm interested to hear a little bit about the funding challenges, and if I mean that may be going into too much detail, but how those challenges were navigated, and to make that happen because it is a real need in our communities.
Yeah, great question. Before we had the clinic, it's all in LCAP. It's a partnership not just within the immediate team. It's having conversations um, with business services and making it a part of LCAP. So it's prioritizing, and it's a conscious effort. It has to be intentional. It's purposeful, and we're going to be setting aside a certain amount of money to buy this. That's why it's so important to have leadership on board. And also, right now, it's family engagement. I think we're in a good place. But before, when we were beginning, family engagement for many years was a board goal. So that also makes a huge difference.
I have a follow-up question. In looking at your board priorities and in your board of education, how were they involved in the planning or in the initiatives, or at least in informing those decisions?
Yeah, we've been very fortunate because our board and of course, there are transitions in board members. So we've had long-standing board members, and then we have some changes, and then we have new ones. But I think it's so important to share the work and to create ownership, not just with our families and our partnering agencies, but also with the leadership, and not just the director and not just the deputy superintendent, but also again with the board members. So that open invitation of having them join and having them see our families in the community store or doing their laundry, and sharing the joy of the work that we do, because I feel so fortunate that within this district, it's kind of like a joke because we get to do the warm and fuzzy stuff, and it's such a good feeling. It's really provides a lot of satisfaction, especially if you're passionate and you love the work. So yeah, but you have to share that passion and create that, share the momentum with others. Don't keep it to yourself. You know, uh, invite others to feel that passion and the love for the community, because that's what it's all about. So if you keep it to yourself, no, you have to show off what you're doing. And we invite people, or people ask us to come and visit us, and they share what we're doing with their own board members. And they don't come just once, they come several times because they bring different board members sometimes. So it's interesting.
Yeah, thank you, Liana. And I think one of your slides earlier just had that list of all the partner logos. I mean, it was really just, several dozen there. And I love that sidebar where you have, the partner, but also what are they bringing, right? Sometimes it's not always, I mean, oftentimes it's not the financial piece, but, human power, right? People power, workshops, other assets that the communities can tap into. And so it sounds like it's just, you're,
And the beauty of
yeah.
this is that if you look at that slide,
Mm-hmm.
so many services are free. So many nonprofits need to do the work that they're doing, and we'll take it. So, but it's work. It's not just, it doesn't happen just like that. There are vendor service agreements, there are hold harmless documents, there are workers' comp exemptions, um, just a lot of things. There's we need your auto insurance, just funky stuff like that. But once the team, everybody is on board, and we realize that, yes, this is something that we need to request more vendors. And even if they're not selling us anything, but they're partnering agencies, if we're all on the same page, then we create this, again, this going back to the system. In the beginning, it wasn't like that. Oh my goodness, and more paperwork. But once you wrap your head around the why, it's because we want to make sure that the district continues to be safe from being exposed to liability. So you just incorporate it and your team is aware and you create these relationships with your vendors or your nonprofits and everybody's on the same page. But you streamline things so that we've been in this business for so many years that you want to make it a smooth process. And when it's not, then you try to overcome the challenges.
Yeah, thank you. Any other questions? Okay, we'll go ahead and wrap up. Ilana, can you just show, I think I want to show, there's a few more slides, but I just want to focus on two and then we can wrap up. We have a lot of different resources at the California Scuba Health Alliance, including our Vision to Reality, which is what we call our sort of SBHC 101 Bible. So please take a look at that. All these materials are free. And then the document that I had earlier is the last one there, the best practices checklist, which is really a great guiding document to help you think about your planning, but also how well you're implementing your school-based health programs. And then I think the next slide is our coalition. Yeah. So we lead a Inland Empire School Health Coalition for Riverside and San Bernardino County. We just actually had our meeting last week, but it's a wonderful convening where we get together and just talk about some of the same topics here. But it's all in person, and oftentimes we rotate the meetings. So we get to visit, school-based health centers, wellness centers, and what have you. And it's just really a great group of people who are really coming together for the same reason. And then the last slide, Ileana, is our upcoming conference. Yeah, so we have our annual state conference, School Health and Behavioral Health Conference. We added the behavioral health in this year to really, sort of have a more of a big umbrella, big tent approach to school-based healthcare. And registration has already opened, and so it's in Los Angeles at the Universal Hilton. For those of you who want to join us, would be delighted. Go ahead and stop the slide share. The rest, there's a few other slides, but they're more for references for all of you if you want to see more of the background on just, parent engagement, things like that. But I'll turn it back over to Mara to close this out. But thank you everybody for being here today and for your attention.
Thank you, Sang. Thank you, Liana. We really appreciate the information that you guys shared today with us. So I will send out an email, a follow-up email with the slides that Ileana had and that they shared today, along with the recording as well, if you want to share with your colleagues that weren't able to attend today's webinar. In the chat, though, I did put in a link for feedback. So we would love to hear, what topics you guys want for the future and just how well we did. And lastly, our last webinar for the year is actually April 7th, and we're going to actually focus on integrating care, school-based health centers, and county behavioral health. So I will share that information and the flyer and the registration in the follow-up email as well. But with that being said, if there's no questions, we can go ahead and end it here. Thank you.
Thank you very much.